everybody, Clay here. This is Green Tongue TV. No, Green Tongue YouTube. Green Tongue. This is Green Tongue Adventures. So what am I doing? I'm going to do a video just like everyone else in COVID land. Okay? Well, what am I going to do a video on? Everybody on all my courses usually ask me what I put in my first aid kit. They asked me that because I have been running outdoor programs for a long time. I'm an advanced care paramedic, and I've taken a lot of wilderness first aid training as well. Also, you know, years of ski patrol and lifeguarding. Yeah, just like lots of first aid in my life, obviously. So I got some ideas, and I'm here to share them with you. I think what's missing out in YouTube land would be some way to look at actually building your first aid kit, the things, categories you might want to put into your first aid kit, and what kind of kit you need. So obviously it's relative to the thing that you're doing. Hiking, you don't want to bring a lot, you don't want it to be heavy, you don't want to take up a lot of room. Boating, you can maybe take up a little bit more room, you can have a little bit more weight, for sure. And that's mostly what we do. Green Tongue is boating. We might get into some hiking later. So I have three types of kits that I use. I have a small wounds kit, which I often always take on a hiking trip or a day trip. This is for small burns, small cuts, and dealing with blisters. The jump kit, this is the jump kit, kind of opened up, spewed everywhere already, but it will be able to deal with, you know, some major injuries. It'll be able to deal with airway issues, some airway issues. Basically, it can handle pretty much everything you throw at it for a limited time basis. And then there's your trauma kit. Trauma kits are, you know, for like standby events, and they're just big. And they have all kinds of stuff in them, and you can go with many different versions. So we're going to just talk about the jump kit and the things that you want to take, and the categories of things that you would split them up into to help you think about how you would apply it all. Okay? I like this kit. This is an AMA first aid kit, but it doesn't have anything in it that it came with. Maybe some band-aids and some triangulars. The reason why I like this kit is because of these big pockets. I can put stuff in there and easily access them. I can also see what's in there too. That's why I like this kit. And things that I think are really bulky will fit in it. It's a little bit big for a backpacking trip or something that I would take for ski patrolling, but it's definitely something I would take on a river, where I'm leading people, or even just with a bunch of my friends, okay? Because I can probably fit this in whatever boat I'm taking. Kayaking, maybe not, but you know, canoeing, rafting, for sure, okay? So enough about the kits. We get into the essentials and the things that go into how you would kind of organize your kit to make it, make sure you have everything that you need. And we're talking about essentials, we're talking about things that will make a difference in saving lives or getting yourself out under your own power efficiently. And as leaders in wilderness expeditions, folks should be paying attention to certain things for sure. And first thing I'm going to talk, well actually let's quickly go over the list, and then we're going to go over it in finer detail. Try to be succinct as possible here. Okay, essentials. Some sort of airway and a face mask. So a lot of people will say, well, I bring like a little plastic barrier that comes in a little pouch like that. It's nice and small. You can stick it in your life jacket, or you can put it, you know, in your pocket or whatever. I mean, it's small and whatever. Sure. If that's what you want, you're comfortable with that. But I am not comfortable with that. I guess it's just, you know, the industry in me. I like to have a face mask, and I like to have a filter on that face mask. And this little band is not necessarily there for creating the seal, but it's just there to keep that face mask on the person between breaths, okay? Your what you're going to actually have accompanying that, if you have the room or the knowledge and know-how, is an OPA or an NPA, okay? Just another thing that's going to make your life way easier if you're trying to do CPR and stuff. And I think for me, as someone who leads people in the river world, we got to assume hypothermia on everybody. And if somebody's hypothermic and then goes into cardiac arrest, we have potential to do a lot of CPR for a long time while we're waiting for rescue. So those things, I think, as a leader, I like to have. Okay, tourniquet, and wound management, wound packing, and a tourniquet. This is your hemorrhage control stuff. Okay, hemorrhage control is important. Catastrophic bleeding sometimes comes before the ABCs. So CABC. So catastrophic bleeding, then the airway, then the breathing, then the circulation. You have to have a way to stop it. Commercial tourniquet is probably the best thing to do to bring with you. If you think that you're going to make one out of a belt or whatever, do you really have the time to do it, and is it going to work, right? Catastrophic bleeding, this is like, it's ready to go. The strap should be zeroed out, so you just slip it over the limb, tighten it up, twist it up, lock it in place, write the date and time on it. Hopefully it works. You know, that in conjunction with some wound packing, you're good. Next thing, soft tissue injuries will require often some tape for some support, like a tape cast, or where you're replacing ligaments or trying to support the ligaments or tendons that are damaged. Okay, to use tape on skin and have it stick for a while, you need tincture of benzoin, and before you put on the tincture, you shave it so that it sticks and it'll last for a few days. And that would be the difference between you carrying somebody out and them walking out, you know, for like a twisted ankle or knee or something. Should you know how to do it. And I don't want to advocate any of these things if they're advanced procedures for whoever's watching, that they do it without actually getting the training. But these are the things I put in my first aid kit to make a difference. And then the next section that you want to think about is like wound management. So burns, blisters, cuts, lacerations, those kinds of things. Bulky dressings, roller gauze, really good to have. You wouldn't go anywhere without it. 4 of these, 4 triangulars, and then all your smaller stuff, okay? Smaller wound dressings, some sterile gauze, some like knuckle bandage, some occlusive dressings, maybe some closure strips. You have to be careful with that in the backcountry. And then, you know, occlusive dressings, I said already, non-stick dressings, second skin, that kind of stuff, okay? And then on top of that, you have to be able to clean out whatever wound comes along. You know, like if it's a fairly deep laceration. And to do that, you want to have a good size syringe. So 30 mil is probably good. You can get away with 20 maybe. And then you would have some sort of catheterized needle that you can shoot that water through and irrigate all the dirt out and stuff. All these things are covered in your advanced wilderness first aid. And then I would always have some scissors. You can cut away some dead skin, some dead tissues after you're cleaning it. Maybe some safety pins to dig out slivers, also some tweezers. Okay, so that's it, your wound management, right? And the medical side of things. So this all has to do with what you're trained for and what you can justifiably put into your first aid kit. Is something that you can give somebody, okay? And as for me, I'm trained to a good level, so I can put in some certain things. But for the lay person, you have to think about what you can get away with. And I'll just go over a few things that you're going to think about. So you can think about treating anaphylaxis. That is with an EpiPen, okay? And if you don't have the training, then it should be somebody else's EpiPen, their own. You can assist them with it. But I carry Epi 1 in 1000 ampules along with a IM needle and a 1 mil syringe, so I can draw it up and give it. Also Benadryl, Benadryl, so multiple doses of epi, multiple doses of Benadryl. You might be treating this over a period of 12 hours, okay? Cardiac, I don't have anything that I can bring with me, and neither do you for cardiac, except for chewable ASA, right? That stuff, that's one thing. So, put that in your medical side of things. And respiratory issues. So I can treat somebody with who's having an asthma attack, at work, as a paramedic, we have salbutamol and ipratropium and these things, and give them these medications. A lot of times they carry them on their own, so you might want to assist them with that and just help them stay calm. But we also have the option of giving a steroid, and if I can bring a steroid, I will bring prednisone, which you take orally, and will help things 2 hours, 4 hours down the road, so you're not dealing with it by that time. Hopefully we're not dealing with respiratory arrest from being too tired. Antiemetics, those are things that help people not throw up, and if they're dealing with significant nausea or some sort of GI treatment, right? Like something that's going to stop people from having diarrhea, so that you can replace fluids and not have it all go away. So yeah, I'll just quickly go over the essentials one more time in each kind of group. Okay, so something for doing CPR, a face mask and OBS. Okay, and with that, in your protections, I will put in, or your PPE, I'll put in, say, gloves. Okay, hemorrhage control, tourniquet and wound packing. Also bulky dressings and triangulars. Soft tissue injuries, how are you going to treat those? Rest, ice, elevation, compression elevation. Yep, and then you have to help people support their injuries with some tape. And then you want some tincture and a razor. Sometimes there's no point in actually trying to apply tape unless you've prepped the area well with those things. Okay, wound kit, burn kit, just talked a lot about that stuff. So all of your dressings, occlusive, for second skin and non-stick, those along with all your band-aids and gauze and roller gauze, and your irrigations, wound cleaning applications, so scissors, irrigation, and tweezers, and let's see here. Oh yeah, okay, so, and then your medical, all your medications and stuff. Okay, I think that's it. Thanks for watching. Bye.
Hey everybody, thanks for watching. Leave some comments, let us know what you put in your first aid kit for whatever specific reason that might be, and also what I might have missed. If you guys want some first aid courses, we do Wilderness Medical Associates, Advanced Wilderness First Aid, and Wilderness First Responder. Check the website for upcoming dates.